Dear students, welcome back. In the previous session, we have seen the mobility and stability of the elbow joint. Now, we are going to see the muscles which are crossing around the elbow joint. Okay, there are 9 muscles which cross the anterior aspect of the elbow joint. Out of 9, only 3 muscles, that is the brachialis, biceps brachii and brachioradialis, have primary functions at the elbow joint. And also the supinator and the pronator teres have major functions in the radio-ulnar joint. The remaining 4 muscles, that is Flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, all these 4 muscles which arise by a common tendon from the medial epicondyle of the humerus, which have primary functions at other joints including the wrist, hand and fingers. And these are considered to be the weak flexors of the elbow. Okay, how many muscles? Totally 9 muscles, and the 3 muscles, the major 3 muscles, that is brachialis, biceps brachii and brachioradialis, which are arising from the shaft of the humerus and which are going to insert on the radius and ulna. Okay. So these 3 muscles will have primary functions at the elbow joint. So these 3 muscles are the major elbow flexors. Okay. And coming to the extensors, so in the extensors also, the major 2 muscles of the extensors of the elbow are, one is the triceps brachii and the anconeus. Triceps brachii and anconeus. And some of the superficial extensor muscles like extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum and extensor digiti minimi. All these muscles arise from the lateral epicondyle of the humerus, which crosses the elbow joint and which has a major function at the wrist, hand and the fingers than at the elbow joint. Now we are going to see the flexors first and then the extensors, from where these flexors are getting originated and getting inserted and its function. Okay, now we will see the flexors of the elbow joint. So the 3 flexors, one is the brachialis, biceps brachii and the brachioradialis. All these 3 form the primary functions at the elbow joint, which helps in the elbow flexion. So now we will see the first one, the major flexors of the elbow. The first one is the brachialis. The brachialis muscle arises from the anterior surface of the lower portion of the humeral shaft and attaches by a thick broad tendon to the ulnar tuberosity and coronoid process. Okay, and what is the action of this brachialis? Flexion at the elbow joint. Okay, next coming to the biceps brachii. The biceps brachii arises from 2 heads. One is short head and the other one is the long head. The short head is a thick flat tendon arising from the tip of the coracoid process of the scapula, whereas the long head arises as a long narrow tendon from the supraglenoid tubercle of the scapula. These muscle fibers arising from the two tendons unite in the middle of the upper extremity, in the upper arm, we can call upper arm, to form the prominent muscle bulk of the upper arm. So muscle fibers from both the heads inserted by the strong flattened tendon on the rough posterior area of the tuberosity of the radius, that is a radial tuberosity. Okay, and also the other fibers of the biceps brachii will insert into the bicipital aponeurosis that extends medially. So this bicipital aponeurosis, we can call it as flattened tendon here. So this will formed by some other fibers of the biceps brachii, and these are going to insert into the bicipital aponeurosis, which extends medially to blend with the fascia that lies over the forearm flexors. So the bicipital aponeurosis, which is going to blend with the fascia of the forearm flexors. Now coming to the brachioradialis, what is the action of biceps at the elbow joint? It causes flexion. Okay, and also it is having an action at the shoulder joint also. Okay, because the long head of biceps is crossing both the shoulder joint as well as the elbow joint, so it is having some action at the shoulder joint also. Okay, now the brachioradialis arises from the lateral supracondylar ridge of the humerus and inserts into the distal end of the radius above the styloid process. So if you can see all these three muscles, the biceps brachii and the brachioradialis insert into the radius, whereas the brachialis is getting inserted on the ulna. Okay, so because of this insertion of this biceps and brachioradialis on into the radius will show the functions differently. The functions of these two muscles will differ with the function of the brachialis because of its insertion. That will we can see in the muscle function later. Okay, now coming to this extensors, in this the extensors of the elbow or the triceps brachii, this one, and the anconeus. So these are the two muscles which helps in the extension of the elbow. Out of these two muscles, the triceps brachii forms the major function at the elbow joint, that is the extension of the elbow joint. This triceps is having three heads. One is the long head, so this one is the long head. Next one is the lateral head and the medial head. And these three heads will have different origins. The long head crosses both the glenohumeral joint as well as the elbow joint. And this long head arises from the infraglenoid tubercle of the scapula, whereas the lateral head arises from the oblique groove, from the upper part of the oblique groove, and the medial head arises below the radial groove. So because of this origins of these lateral and medial heads from above and below the radial grooves. At the middle of the arm, at the middle of the radial groove, the medial head is present medial to the lateral head. And this long head of triceps united blends with this lateral head of the triceps, forming a superficial tendon which are going to insert on the olecranian process. And the medial head tendon which will unite with the superficial tendon, and it is getting inserted into the olecranian process. Okay. In this medial head covers an extensive area on the medial aspect and the posterior aspect of the humerus. Okay. So this is about the origin and insertion of the triceps. Coming to the anconeus, this is a small triangular muscle which is arising from the posterior surface of the lateral epicondyle of the humerus and extends medially. So, and it is going to extend medially to attach the lateral aspect of the olecranian process, and which is just adjacent to the proximal quarter of the posterior surface of the ulna. Okay, simply you can say it is going to insert on the lateral aspect of the olecranian process. Okay, so these are all the origin and insertion of the extensors of the elbow joint. So this long head of triceps, it is crossing both the shoulder joint as well as the elbow joint. It is having some function at the shoulder joint. So these are the major muscles which are going to act on the elbow joint, and the remaining additional muscles which are having primary actions at the wrist and fingers, which are originating from the lateral humeral epicondyle by way of common extensor tendon. And I have already mentioned those muscles, that is the extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, and extensor digiti minimi. Though these muscles are crossing the elbow joint, but it is having a major function at the wrist, hand and fingers. So now we are going to see this muscle actions on the elbow joint and what are the factors affecting the action of muscles on the elbow joint. We will see in the next session. Thank you.